Good afternoon, everyone. I am Anne Marie Costella, and I am the Director of Communications for New York State Senator James Sanders Jr., who will be joining us very shortly. But in the meantime, I will be your temporary host on our show, Let's Be Clear with Senator Sanders. Here, we try to take complicated topics and make them simple, digestible, clear to everyone. So in this age of fuzzy thinking, when you can't get a straight answer to a straight question, we are going to break down the nuts and bolts of this issue, and we're going to talk plain talk for us regular folk. Okay, so October is Breast Cancer Awareness Month, and I have put together the best panel that money can't buy. And I am going to introduce each one of them to you, and then they will further explain why they're here and what they do. Okay. When you watch one of Senator Sanders' other shows, you'll realize why this introduction is so funny. Okay, so our first guest, I'm going to go through all of them and then we'll come back around. Our first guest is Ruth L Vega, Director of Cancer Screening, Outreach, and Education for the American Italian Cancer Foundation. Then we have Dr. Sharon Koehler, Breast Surgery and Oncology at St. John's Episcopal Hospital. We have Yadira Rosemin, Associate Director, Outpatient Operations at Memorial Sloan Kettering Cancer Center, Ralph Lauren Center. Jennie Santiago, Co-Director, LatinaSHARE program at Share Cancer Support. And last but certainly not least, we have Sharon Hamlin, Far Rockaway resident and breast cancer survivor. So we're going to start right in the senator's own district with Dr. Sharon Koehler, and then we will get an introduction from each of our other esteemed panelists. So Dr. Koehler, please enlighten us.
Oh, thank you. Thank you so much. I'm really happy to be able to participate in this enlightening event. I hope we get a lot of good information out there. So I'm Dr. Sharon Koehler. I am a fellowship trained breast surgeon. That means that after medical school, I did a general surgery residency and then completed a breast surgery fellowship. I specialize in the treatment of breast cancer and other breast diseases. So I will take care of patients who have breast pain, cancer, if they happen to find a mass, they have abnormal screening exams and need some questions. Maybe they just have a genetic predisposition in their family, or they're concerned about that and they want genetic testing. We do that here at St. John's as well. If you have swollen lymph nodes in your armpits or an infection or simply nipple discharge. So basically anything wrong with your breast, I'm happy to take care of it. I don't make them bigger or smaller. So sorry about that, but I do take care of anybody's problems. St. John's is so proud of the program that we're putting together here too. We have the Margarito Carpenter Women's Health Center, which is slated to open in the winter of 2020. So the Rockaway Peninsula is going to be really enhanced by this incredibly comprehensive program to help women in the community. We'll be offering 3D mammograms and GYN behavioral health, of course, myself, breast surgery, GYN oncology. We're even including a new plastic surgeon who can make them bigger or smaller if you're interested. And we'll have maternal fetal medicine, basically a really, really comprehensive program. So I'm so happy to be joining this group and would love to give more information about breast cancer as the program continues.
Okay, so now we'll take it over to Yadira Rosemin from Memorial Sloan Kettering.
Thank you, Anne-Marie. I am Yadira Rosemin. I'm Associate Director at Ralph Lauren Center. It's one of the outpatient sites of Memorial Sloan Kettering Cancer Center. And we like to celebrate, Breast Cancer Awareness Month all year round. We are happy that October is highlighting it, but really ask women to get mammos all year round. We do mammography here on site. We also participate with CSP, which is Cancer Screening Program. So for those residents that do not have insurance, we welcome them and are able to have their screening done. If they need additional resources, we're able to provide that for them as well. So really proud to be on this panel with these wonderful women, and really proud to represent MSK.
Very well said. Okay, let's take it over to Jennie Santiago from LatinaSHARE.
Good afternoon. Thank you for inviting me today. I am Jennie Santiago. I am the co-director of the LatinaSHARE program at SHARE Cancer Support. SHARE is an organization, nonprofit, and we've been around for many years offering support groups, online educational programs. We do outreach to the community. In the LatinaSHARE program, we have the same programs that SHARE has in English. We offer them in Spanish, that's support group, educational programs, outreach in Spanish. We do a lot of collaboration with other organizations as well to bring as much information to our participants as possible. I am also a survivor patient navigator, which is a program unique to SHARE. I was trained to do this work, and I worked for 14 years at Mount Sinai Morningside Clinic, the breast clinic. I still do the work, even though I'm not there in person. I still do work on phone or online with patients that need our services, and I'm able to give them, whatever guidance they need throughout their cancer journey, and give them a lot of resources, which we have at SHARE. We have a national helpline that is manned 24 hours a day and in several different languages, and I'll put that information up on the chat soon. And what else can I say? And I'm here to represent my organization, which I've been with for over 16 years.
Okay, so we cannot forget about Ruth Vega from she's the Director of Cancer Screening, Outreach, and Education at the American Italian Cancer Foundation, which does a lot of mobile mammography in Senator Sanders' district. So Ruth, please share with us.
Thank you for having me. Again, my name is Ruth Vega, and I'm director of the Mobile Mammography Program at American Italian Cancer Foundation. We've been around for about 35 years serving New York City. We have a mammogram bus that travels the 5 boroughs. And of course, we go out to District 10 and serve a lot of the constituents of the senator. We've partnered with a number of organizations that are on this panel, and we work closely with community-based organizations because we know that they know the women who we are trying to reach the most. And our goal is really to make breast cancer screenings accessible to women, whether they're insured, uninsured. We just want to make them accessible. So we bring our mammogram bus to the women. So whether it's where they work, where they are living, or even where they worship. So we bring our mammogram bus out Wednesdays through Sundays, so both on weekdays and weekends, to ensure that women who are working have access to us on the weekends, or who are taking care of others, which is what most of us women are doing, taking care of families and the such, have access to them. We see both women who are insured and those who are uninsured. Those who are uninsured do get enrolled in the Cancer Services Program of New York City, so that if they need any follow-up care and or treatment afterwards, then that service can be at no cost to them, which is very important. One of the keys to our success is really our partnership with community-based organizations, because they have the cultural and linguistic capacity to serve the women. So together in partnership with them, we see about pre-pandemic, we saw about 4,000 women a year. We imagine that number will be slightly less this year, just because we're spacing the women out a little bit more on the bus, etc. And our outreach, we're doing a little bit less of the street outreach, but we continue to do a great deal of outreach, both online, which has been extremely successful, and through our partnerships where women go to get their services, their other services. So we're excited to be back out. We were down for a little bit, but we're excited to be back out and be providing this much needed service. October being Breast Cancer Awareness Month, is great to get the word out and to really bring women who would normally not come out to screenings. But we like to say that every month is Breast Cancer Awareness Month, not just October.
Okay, and we'll take it over to Sharon Hamlin, who is Far Rockaway resident and breast cancer survivor. Sharon, tell us a little bit about your story.
Hello, hi. My name is Sharon Hamlin. I'm a breast cancer survivor. I found out that I had a lump in my breast on May 16th, 2013, while I work here at Mount Sinai, and I just went for my mammogram. And when I get my mammogram, they usually do a sonogram also, so they discovered it in my sonogram. So I had my lumpectomy on May 21st. So being here at Sinai was a blessing to me because everything just went so smoothly. And I guess because I work here, they treat you like their own. And so from the time I found out that I had breast cancer, it's like they just moved everything and just made it so easy. So I had my lumpectomy on May 21st, and I started chemo on July 25th. And because I was a stage 2 breast cancer person, I was ER positive, PR positive, and HER2 positive. And the cancer was growing very rapid. So they treat me, they try to treat everything really fast. So I did 14 months of treatments with radiation included. And now I'm on 10 years of tamoxifen. So that should be over in the next 2 years, but I'm still here to tell my story. So I'm happy to be here and to join the discussion.
And we're here. We're very happy to have you, Sharon. Thank you for sharing your story with us. I have a couple of questions that I would like all of you to address. The first thing is I would like you to speak to the women out there who think because they don't have a history of breast cancer in their family, that they don't need to get a mammogram. The second is people who do go for mammograms find out, as I did very quickly, that they are extremely uncomfortable. Why is that? And how can we get people over the fear of just, not wanting to go get a mammogram because it's not pleasant? And also talk about the treatment as it's progressed over the years. In 20 years ago, I know from my own mom's case, they used to do mastectomies. Now it's moved more to lumpectomies rather than removing the entire breast. So my first question, playing devil's advocate, as Senator Sanders often does, let's say, well, in my case, I do have a history of breast cancer in my family, but let's say I had no history of breast cancer in my family. I've heard all the commercials. When you're 40, you get your first mammogram, but I don't have any history. I don't want to get a mammogram. They flatten your breast. It's painful. It's uncomfortable. Why should I go? Let's start with, let's go in the order we did before. Let's start with Dr. Koehler.
Hi, thank you so much. So yes, please go.
Senator, you're underwater, so we're going to continue on without you. Dr. Koehler, please continue.
Sure, thank you. Yes, those were very, very excellent questions. I was so happy that you asked all of them. People without a family history represent about 80 to 85% of the breast cancers. It's only about 15-20% of women with a family history that are represented in the total number of women with breast cancer. So it's very, very important for women to get their mammograms and screening and take every sign of a problem very seriously. The sooner you get detected, the sooner you are diagnosed, you will have much, much better survival. So that being said, really the best way to detect breast cancer is with the mammogram. That is the best test. It is painful, possibly, but actually the newer machines that are 3D and they happen to have flexible panels, they have like a curved breast simulated panel, so it's not as painful anymore. In fact, in the Rockaways, Senator Sanders will be happy to know that St. John's has purchased 2 of these machines, and they're currently doing 3D mammograms with much less pain. So please, I hope women are not afraid. In fact, just today, my patient came in and told me how wonderful. She was terrified. She had implants, didn't want to come in for her mammogram because she thought something terrible was going to happen. The first time she had one about 8 years ago, it was very painful and she was afraid. So she had one about 2 days ago and was very, very happy. It was not painful. So please, I implore you, if you don't have a family history, but you happen to have breasts, you're a woman, please get your mammogram. And the treatment, you were asking about treatment and how it has changed over the years. It has become a totally different disease in terms of how we treated it compared to when I began my medical career. We basically divided patients based on their age and their stage, and you got a set treatment plan. Not anymore. We are treating patients in a way that is targeted to their particular cancer. If you happen to have certain receptors like the HER2 receptor that was overexpressed in our lovely patient's portrayal of her disease, there's a different treatment. There's also a different treatment for people with estrogen receptor positivity. So we can target those as well. The surgical treatment is often less aggressive because we have found that lumpectomy with radiation is equal in outcome for many people compared to mastectomy. So women do often have the choice of conserving their breast. We also have been giving a lot of systemic treatment first to maybe shrink tumors, to make them more amenable to breast conservation. So the amount of tissue that has to be removed has definitely changed compared to what maybe your mom or your grandmother may have experienced. So that's important to know. We're also doing different things with the lymph nodes. We're not removing as many lymph nodes because we can treat them in other ways. And that's decreasing the amount of arm swelling that can happen after that type of surgery. So the treatments have very, very much improved. Survival has improved. And with early detection and all these advanced treatments, we're really able to make a difference in people's lives. 85% of women who are diagnosed with breast cancer survive, but those are the patients that are found at early stages. So we really need to encourage women to come in, not be afraid, and seek help as soon as they possibly can. We can't prevent the cancer. There are some things we can do. We can maintain a healthy weight, especially if we're postmenopausal. So that we're not increasing our risk, obviously avoiding environmental toxins, smoking, excessive alcohol use. It might reduce your risk of breast cancer slightly, but the biggest thing we can do for ourselves is to detect the cancer early so that we can treat the cancer as easily with the least amount of morbidity. You find a cancer that's stage 0 or 1, you may not need chemotherapy. You may find it later and have to go through a terrible treatment. So definitely we want to support the women and have them come in for early detection.
Okay, very well said, Dr. Koehler. So I want to talk to Yadira. So you are at Memorial Sloan Kettering, which, as I told you prior to the broadcast, has a special place in my heart because my mom, who had initially a mastectomy and then later, about 10 15 years later, a lumpectomy, received excellent treatment at Memorial Sloan Kettering. And your center has a very unique model. Yadira, can you hear me? Or,
I can, yep. Can you hear
okay,
me?
your center has a very unique model because it's not like a regular hospital. People are scared. They don't know how to feel. I know that my mom had a support system, you know, but some of the women who we encountered, it was heartbreaking because we heard them say things like, I'm not really a woman anymore because I don't have my breasts, or I don't have my hair. And it just, even now, it's just so emotional for me that they had to go through that. But they received such wonderful support at Memorial Sloan Kettering. Tell us about that unique model.
Absolutely. So I will say I'm not a clinician, so I will not get into as much of the clinical details as Doctor did. But just from the model standpoint, we really do see patients as, you know, holistic beings, and really they are not defined by their diagnosis. And so really trying to understand their support system, us being part of that support. They come to a site here at Ralph Lauren Center that does not look like a hospital. You're right. It is really like a family room. You walk in, there are comfortable couches, there's artwork. It really just feels like you're coming home, and you have staff that look like you, that speak your language, and really just we take care of the whole person. We have nutrition services, and so if you come, you know, you might get a mammo, but you also need a food pantry. You know, you need other services, and we provide those services here as well. We have a social worker that's on site. You know, if there's other needs there, we try to meet them. So really just knowing that we're all full beings. It's not just about a diagnosis, and really just trying to see people and meet them where they are. And so thank you for the opportunity to speak here, and I'm honored that that MSK was able to assist you and your family.
Thank you. So now I'm going over to my cheat sheet here because I don't want to forget anyone. So Jennie Santiago from LatinaSHARE, we had spoken, you had told me a little bit about how your program helps Hispanic women, immigrants, some of whom who don't speak English, which makes the process even more scary. And you are there for them to meet their specific needs. So since this is also Hispanic Heritage Month, tell us a little bit about that piece of the puzzle.
So as I mentioned to you yesterday, I am a 20-year breast cancer survivor, and I came to SHARE as a support group member, a LatinaSHARE support group. And I was there and I saw the need for many of these women who came to this country, had no benefit of language, had no way of communicating with their doctors. When asked what their diagnosis was, they had no idea. There was so many needs that these women had. And so I decided to dedicate my time to helping them. Instead of sitting there in that support group, they needed my help. So I began volunteering with SHARE, and I did outreach work. I finally decided that this is what I want to do. So I actually joined the organization. I had a lot of specialized training. I am trained to do the helpline. We have a national helpline in Spanish as well. We have support groups throughout New York City. When we met in person, now everything is done, virtually, because we all work from home as everyone else. We have educational programs that are geared to survivorship and patient needs, not only on breast cancer, but other aspects of life as well. We have legal programs, we have psychological programs, we have nutrition, meditation. We cover just about every type of topic that might be of interest and can help the patient or survivor. When I came to use LatinaSHARE's programs, I had just been diagnosed, and I was towards the final phase of my treatment. You mentioned the importance of mammograms. I had a mammogram every year. I chose a month of the year. That was really important. Every year in July, I have a mammogram. And it was important for my family doctor to know that I had a family history of breast cancer. And she was smart enough to keep that in mind, when caring for me. So one year I had a mammogram, and in between the mammograms, I had a diagnosis. It was only 11 months after my prior mammogram that I was diagnosed with stage 2 breast cancer. And I was able to deal with it quite well. But I know that many women cannot. And that's where a support group comes in. It's so important to have that support of women that are going through the same treatment that you are, or maybe a different treatment, but they have had a breast cancer diagnosis. And it's, even though you have family members, you have friends, they haven't walked in your shoes, it's not going to be as helpful as being in a support group. Which in our case, Latinos have a tendency to be very social, and our support groups become sort of a family place. We're family to each other. I have people in my support group that have been there 10 years. They don't want to leave because they get they get educational programs, they get one-on-one support from us, they get support from each other. They don't just meet at the times of the meetings, they seek each other out outside of the group, which is great because they always have that support system that's so important to getting through a diagnosis and treatment, which can be difficult at times. So yes, it's so important to get that mammogram yearly, whether or not you have family history or not.
Okay, so Ruth, from the American Italian Cancer Foundation, I keep wanting to reverse it and calling it the Italian American. The American Italian Cancer Foundation. Now, you guys are all around our district with your mobile mammography. So tell me about the women you encounter. What do they say to you? What's the interaction like? What are different parts of the community like?
Yeah, no, definitely. And, I will echo some of the stuff that you said that keeps women from getting their mammograms. One of them is fear. They're just afraid. They're afraid that it might be painful. They've heard stories about how painful it is and other people who've had it and how painful it is. They're also afraid that they might find something. And so what we do is we really work with them one-on-one. So we're calling them on the phone or speaking to them when they come to our outreach events and just talking to them and letting them know the facts and what they can expect. We talk about what it is that they are afraid of. So when they do say that they're afraid because they heard it was very painful, we reiterate what the doctor had said, that it's not as painful as it was in the past. So if you heard stories about people, 10 years ago, your mother who had a mammogram and it was extremely painful, now it's a little different. It's we also don't sugarcoat it. It's not the most comfortable of exams. And pain thresholds for people are very different. But one of the things that we do stress to them is that it is better, or it is for them to maybe go through a moment of being uncomfortable. And again, it's minutes. It's not like it's hours. So it's minutes of being uncomfortable. But if that is going to give you a diagnosis early, that is going to potentially save your life. Instead of waiting until it is obvious that something is wrong, and then you discover that it's in the late stages of cancer, and your survival of it is going to be minimal. So we encourage women. We let them know that early detection, they could get, if something is detected, it could be treated, and the treatment may not be as harsh or intensive as they may think. And the important thing is that early detection so that they can survive. And as caregivers, a lot of the women, the other thing that we hear is that they don't have time. I don't have time to take care of the kids. I got to pick up the kids. I got to do this. I got to do that. And one of the things that we like to do is just let them know, listen, we're available weekends, weekdays, whenever you're available, we'll find a spot for you to get your appointment. And the other thing that we tell them is, if you're not healthy enough to take care of others, then who is going to take care of them? So if you're really concerned about your family, now that women are not just taking care of children, but also of parents, we tell them, you have to make sure that you're healthy. So get your exams, get what you need to do to stay healthy, because if you're not healthy, you won't be able to take care of anybody. And so those people who depend on you will not have you there to take care of. That usually works. I mean, it's the truth. It's a reality of what's going on. So we do like to let them know that. But we like to talk to them and see. We have patient navigators on our team, so they talk to them one-on-one, and we break down those barriers. Sometimes we have women who make an appointment and then don't show up, which is something that happens. So we call them back and we just find out, like, what happened? Were you not feeling well? What's going on? Some of them are afraid, like I said. And so then we encourage them to come. We let them know we're going to be there. We also let them know what to expect. So when you come on the bus, what's going to happen? You're going to do your medical intake. You're going to go talk to a nurse. And this is the mammogram. And this is how it's going to happen. And this is what's going to be done. And then you'll be done. And under an hour, you'll be out. And, knowing what's going to happen sometimes eases that fear. We also get the I don't have a family history, and we of course let them know what's recommended, and we let them know that 1 in 8 women are going to get breast cancer in their lifetime or be diagnosed with breast cancer, and it doesn't necessarily occur in women who have breast cancer in their family. So we try to answer the questions as they pose them to us, meet them where they are, and walk them through the process. We also serve women who are monolingual Spanish. We have staff who are bilingual and are able to talk them through that process. So our biggest challenge is not so much when they get to the bus, it's more getting them to the bus. Once they're on the bus, it's a done deal. They get their mammogram and they go. So we work to really bring them in, to talk to them, to explain to them what could be expected. And that usually is how we get the women in and are successful with this program.
Okay, so now I want to go back to Sharon. I don't want you to feel neglected, Sharon, because you are super important, because you are, as some of our other panelists are, a breast cancer survivor. Tell us how you got through, your health condition, your diagnosis. Tell us about your support system. Did you join a support group? Did you lean on your family? What was the experience like for you?
Well, I had a wonderful support system. I had my family. Like my first consultation after I received my diagnosis, it's like the women in my family, it was 5 of us in the little doctor's office, and they asked more questions than I did. But and then here at Mount Sinai, they had a wonderful team. So I had my own nurse and the doctor, and my nurse always told me before I started treatment, she said, the way you go into treatment is the way you're going to feel. So I always made sure that anytime I had to go to chemo, I dressed up and made sure that I was feeling great, and I never let my cancer put me down, because I always thought that it was meant to be. To me, it was a part of my journey in life. So I just kept my head up and did my treatments, and I had my family. I had my department that I worked in with me. So, because I told the doctor I wanted to work during my treatment. I needed to work because I knew if I stayed home, I wouldn't be any good. And they were able to put me in a private office by myself. I drove to work every day. So I had a really good support system, a good work support system, a good family support system. And my doctors and the team, my chemo team, they were the best. They always made sure that I was fine when I went down to chemo. So I had an all around good support.
Mhm. What would you say to women who are, just diagnosed with breast cancer, who believe that it's a death sentence, which we all know now that things are not the way they used to be, and it is far from that. But there are some people who still believe that. How do you feel about that? What would you say to them?
I would tell them that I'm still here. 8 years, I'm still here, and they can get through it also. And I always tell ladies that I meet who are going through it is that you can call me and we can talk about it. You can cry on my shoulder and, it will be all right. It's not a death sentence. Your hair will grow back. You'll live your life again. It might stop for a little period of time, but then once everything is fine, you go back to living life again and live it better than what you lived it before.
That's very inspirational, very inspirational. Can you also talk a little bit about that feeling about, you mentioned that your hair fell out from the chemo?
Mm-hmm. Yes. Well, my nurse told me to cut it off before I started chemo. She said that's the worst thing to do, is knowing that you're going to go through chemo. Because she said my first set of chemo was, they call it the red devil, and it was going to make my hair fall out. So she said, go and cut it off first so that you don't have to be there and watch it fall out. And I think that was the best advice she ever gave me. So I cut my hair off first, and then.
And how did that feel? How did that feel, cutting your hair up?
At first, I was a little bit upset because it was so much hair, but it's life. To me, I was like, I'm still going to be here. The hair will grow back. So,
Did you feel any sickness from the chemotherapy? Like any nausea or any kind of symptoms from the chemo? Was it tough for you?
It was tough, but the way that I had them set it up, because I was determined to go to work. I had chemo on Thursday, so after chemo, I would go to work. I'll go back upstairs to my office for a little while. And then Friday, I had to come in for my shot. And then the weekend, I would be dead to the world. I didn't know anything until Monday, when I bounced back like nothing happened. So I'll be laid out in bed and just doing nothing for the whole weekend. And then Monday morning, I'm like back at it again, getting ready for work and starting my week all over again.
Okay, I have still a million questions, and I know we're supposed to keep the show to an hour, but we started a little late. So I'm going to go back to Dr. Koehler, because you mentioned something when you spoke before, and I have questions about this. People who have breast implants, does that affect their chances of getting breast cancer? Does it have any impact on getting a mammogram? Can they pop? And if you have a mastectomy, should you get reconstructive surgery, will that increase your chances of the cancer coming back?
Okay. And so let's start with the first question, I guess. If you have implants, are they going to increase your risk for breast cancer? Was that the first one?
Right.
Believe? So the answer is no. They do not increase your risk for breast cancer. They, any sort of breast surgery can cause some scarring, and it could increase your risk of missing a cancer if your mammogram doesn't look as clear as it was prior to having some sort of surgical procedure to your breast. And in particular, it's the breast reduction. There's a lot more cutting of breast tissue in that procedure. So I think anybody who is thinking about some sort of augmentations, it certainly get their imaging and just get cleared to make sure everything is fine, good before you go. But it will not increase your risk of breast cancer. There is a very rare cancer that does seem to have been caused by some of the earlier types of implants that people were replacing, but now people that have had them should have been notified, and I think they're getting replaced. So let's so if you hear about it, I don't think that's a risk. The second question about, well, now can I still get a mammogram? They're going to squeeze and pop my implant. So that does not happen. They have a way of pulling the implant and pushing the breast in a way to image the breast itself and not pop your implant. So that you should not let that be a cause for you not to get your annual screening. And I do say annual screening. There are some organizations that are recommending screening less frequently, but I think there are enough aggressive cancers that we need to find at early stages to support the mammogram every year and continuing until a woman is no longer in good health. Now let's see the reconstruction. Now that was the third question. There were rare instances where reconstruction would be delayed, maybe an inflammatory breast cancer, which is a very aggressive cancer. We would try to postpone reconstruction until the treatment is completed. But otherwise, I think reconstruction is a very important tool for women to feel whole when they're done with their surgery. So if they need the mastectomy, the plastic surgeon can be right there next to me, starting the reconstruction or actually completing the reconstruction at the time of the original surgery. It's really very tailored to the patient's the patient's desires and their clinical presentation.
So, but can reconstructing the breast and basically putting it back, can that increase the chances for the cancer coming back?
No, not at all, not at all. Well, the reconstructed breast, they're done a few different ways. A lot of people use an implant. They'll use the silicone implants, and they do not increase your risk for breast cancer, and the implant itself will not do anything. It's just sitting right. It's usually tucked under the muscle, the pectoralis muscle. They tuck it underneath, and there's a flap of skin over it. So it's the same procedure. You may just have a little extra skin left behind if you do the implant right away. The other type of reconstruction would be using autologous tissue. That's tissue that comes from the patient's own body. Sometimes the plastic surgeon will take a piece of tissue from the stomach and move it up and bring it right to the area where the breast is now missing. They can do free flaps. They can use pedicle flaps. It really is very tailored to the patient. And that tissue itself is tissue from your tummy. It's not going to develop into a breast cancer. So no one should be afraid to get their breast reconstructed if we feel that it's an option.
Okay, and also just to let people know, you don't have to have reconstruction if you don't want. There are special bras, special garments that are made with pockets where you can, it's like a fake breast that goes in the pocket. So you're wearing this bra and nobody can tell, right?
Absolutely.
Yeah. So
and they feel exactly like a breast too. So if you were to bump into somebody, hug somebody at a wedding, whatever, no one would ever know. Mm-hmm. So yes, you absolutely have that choice as well.
Right. And
it's all covered. Some people are concerned. My patients want to know if their insurance will cover their reconstruction because they hear that plastic surgeons are all cash. Well, here in New York, everything is covered. If one breast looks a little bit different because of your cancer surgery, your insurance company will pay for the contralateral, the other breast, to be reduced to match. It's all 100% covered, even with Medicaid and the HMOs. So whatever your insurance is, it will be covered. And we also have a lot of charity care for people without insurance. So that should not be a concern.
Did we lose? We lost Yadira. Okay, so we're going to have to get ready to wrap it up soon. Like I said, this is an important, a fascinating topic. I could just talk to you ladies for hours and ask a million questions. But let's take another, let's take a simpler question. So October is Breast Cancer Awareness Month. Why is it important to designate a month for this illness? We'll go to Jennie. We'll go to Jennie and this time, and you can start.
Designating a month for the illness? Well, no, breast cancer happens year round. Yeah, the designation of a month is to bring information to women at that particular time and educate women, but it's not because it doesn't happen, throughout the year. Yeah, and it's a reminder for women, it's October, maybe I should get my mammogram. But in my case, I chose my own month, and every year in July, I have a mammogram, and that's really important to me. So you have to make that decision to have a mammogram. You must, whether or not you have a family history, that's really important to make time for that. A lot of women don't get mammograms, as I've learned from being in the clinic a lot, because they're afraid of hearing that word cancer. I mean, that just, it implies so many things. And the first thing you think of cancer, I'm going to die. No, I'm there to tell them, as a 20-year breast cancer survivor, there is a lot of living to do after a diagnosis, but you have to get that diagnosis in early to make sure you have a good outcome. And it's important that women know that their family doctor know their family history, because he also can be vigilant and tell you, listen, you have a family history. You really should be getting screened every year without fail. And in my case, that's what happened. That was great. She didn't have to remind me. I knew my family history. But some people they just don't talk to each other in the family. I know women that, oh, I don't think I have anyone in my family that has had breast cancer. Well, have you asked? No. Well, it's important that you talk to the other women in your family. Everyone in my family knows that I'm a breast cancer survivor, and they're at risk. I have a sister. My sister is also a breast cancer survivor. I'm number 5. She's number 7. So I have a strong family history that I had genetic testing. I did all the right things. I know how to do my research, but many women don't. And my role as a patient navigator is to help these women through, from start to finish, from time of diagnosis through their treatment phase and beyond, making sure they go into a support group, making sure they have those resources that they need. And that's what we do at LatinaSHARE and SHARE. We make sure that they are educated, they are well informed about their own type of breast cancer, that they're part of their medical team, their decision making. All of that is very important, because many women don't speak up when they're at the doctor. I find this with the Spanish speaking population. So I can be their voice. I am the intermediary between the patient and the doctor. The patient can call me and I'll pick up the phone. Doctor, this is what's happening with this patient. Can you address that? Or maybe it's something that I can do for them through my organization. So it's so important to have that mammogram and not wait until it's too late.
Right. Let me correct myself. When I was saying about having October as Breast Cancer Awareness Month, I don't mean that, people should only get a mammogram in October, but it is a time when you see everyone wearing pink ribbons, everyone is telling their breast cancer survival story, or maybe they're sharing their reflections of a loved one that they lost. It's a time of coming together, an opportunity to come together. And I think, and publicly come together and maybe take out some of the shame that might be associated with having breast cancer, because like, as I said, it's a horrible thing that sometimes, women that they feel that if they don't have their breasts or they lose their hair, that somehow they're less a woman. But this is really an empowering time. So with that, I'm going to let me, who should I go to next? Let me talk to Sharon about that. We'll go to Sharon. How do you feel about having the month designated for breast cancer? Does it mean a lot to you? Does it not mean anything to you? How do you feel about it?
It means a lot to me. And I'm, yes, breast cancer happens all year round. Everybody should be informed all year round. But having a month and it's celebrating the survivors for everything they've been through. It's gathering people together that they can share information. And it's also celebrating those who haven't survived it, to know that, they've been through a battle, but, they're still here with us because they're in somebody's heart of remembrance. So it's good to have a month dedicated to breast cancer so that, people can get information because people will join a walk and really just because they'll know that a family member or a friend joined it, and they'll learn different things and they'll hear different people's stories. And to me, having a month is a celebration for everyone who's battled this disease.
Okay, Ruth, how do you feel about the month?
I feel great about the month. Now, I think that it's important to have, and that they've designated a month to this, because yeah, our battle is year round. We go out there, we're doing the outreach, we're doing the talking, but I think designating a month, first of all, gives importance to this cancer, and that thousands of women are diagnosed with this every year, and bring awareness. But it also, I think, helps to start the conversations with people. So maybe, you start a conversation, you let women know about it. They start to, it's something that's been, that they're hearing all month. They might not even get their mammogram that in October, but they're starting to think about it. They're starting to have the conversation with their doctors or with their friends. And they then, decide, okay, it's time. And so I think it's important to have a month dedicated to this, and to really focus on the women who have survived cancer, those who haven't, and the disease itself and what it really is, and how it's detected and how it's treated.
Okay, so we are coming to the end of our show, so I'm going to go around one more time and get final messages from each one of you. So Dr. Koehler, we'll start with you.
Well, again, thank you so much for allowing me to participate. And I really encourage all the women who may be listening to this to please go for screening, find your cancers early. It can save your life. And we're really here to help you. St. John's is here to help you. And we do have, I was very impressed with a lot of the services that Memorial Sloan Kettering was offering at the Ralph Lauren Center. Well, guess what? You can come here to St. John's too. We have patient navigation. We have translation services. Most or many of our staff are bilingual or trilingual. We are here for you, and we are putting together an amazing program for the women of the Rockaways. So please don't hesitate to come in. We want to help.
Okay, Jennie?
Thank you for having me today. I would say know your body, have yearly screenings, be aware of the signs and symptoms of breast cancer. Make sure that your primary doctor knows your family history. Don't be afraid to ask questions, and that you should be able to be a part of that treatment team and make informed decisions. Get a second opinion, very important, and learn all you can about your breast cancer, and join a support group. Do research, call SHARE, Cancer Support, and LatinaSHARE. And I'll put the number on the screen in the chat.
Okay, Sharon?
I would tell everyone, don't be afraid. Get your mammogram. And if it is that you do have breast cancer, find a doctor that you're going to be comfortable with, because you'll be spending plenty of time with that doctor. And look for resources and, support group, and get all the help you can get. But don't be afraid. It's just a journey and a part of life, and you'll survive and you'll be fine.
Ruth?
I would say I agree with everyone. Just encouraging women to get their annual mammogram is the most important thing, no matter where they go to get it. They could come on our bus. They could go to the hospital. They could go wherever. There's many, many places where they could go, and they could get it at no cost. And we just want them to come and get their mammogram annually, and to stay healthy. That's the most important thing. And just to know that there are supports out there for you. If you have any questions, you could definitely call our hotline. Obviously, LatinaSHARE also has a helpline, and the hospital, I'm sure they do as well. And we welcome you to please reach out to the resources that are in your community to get the answers that you need to come into screenings every year.
So as I was I don't know how to close out the show, but I will say this. I will say that Senator Sanders is going to be co-sponsoring 3 breast cancer / domestic violence, because it is also Domestic Violence Awareness Month, 3 walks over the next 2 weekends. If anybody watching the show has questions or needs resources about breast cancer or how to contact any of these wonderful women who we had on the show today, you can call Senator Sanders' office. The number is 718-523-3069. And I would have to say, just from, for whatever significance it has, my own personal story, that when my mom went through breast cancer twice, I was there to support her, even though it scared me to death watching what she went through. And then when it was time for me to start getting mammograms and I was afraid, she was there to support me. So I'm sure that everyone watching either has had breast cancer or knows someone who has had breast cancer, has been touched by it. And I would just say, go and show your support for those people, and they will show their support for you. And this is a very important month. And I agree with everyone, go get your mammogram. Senator Sanders' office is here to support you in any information that you need. Call our office. So with that, I would like to thank again, let me go through my guests here. I would like to thank again, Ruth Vega from the American Italian Cancer Foundation, Dr. Sharon Koehler from St. John's Episcopal Hospital, Yadira Rosemin from Memorial Sloan Kettering, Jennie Santiago from LatinaSHARE, and of course, Sharon Hamlin, Far Rockaway resident. Thank you, ladies. I appreciate all of you.
Thank you
and
for
I
having
will
us.
talk to you again soon. And with that, we're going to conclude our show. This has been Let's Be Clear with Senator James Sanders Jr.
Thank you.
Thank you.
Thank you.